One Health is the idea that the health of people is really connected to the health of animals and to the environment that we share. And sometimes that environment is our ecosystem, and sometimes that environment is the shelter. And when the health of one of these groups is good or bad, it affects the health of the other groups. So if your shelter protocols are okay for the animals, but they're not okay for the people, either because of the way the protocols don't fit with your shelter environment or even workplace safety concerns, the human health and animal health suffer. Or to put it another way, if your protocols for animal care are really good and your staff feel really safe, confident, and supported, you might be able to get away with having less than ideal components of your shelter environment, which I certainly see a lot of shelters struggle with. There are a lot of ways our own health is impacted by the work we do in animal shelters, and these impacts are unique. Unique within the animal care field because we have so many other things that we do with animals besides just feed and water them, and unique within the veterinary field because most of the time veterinarians are not also in charge of housing and the behavioral care of their animals. And we think of the hazards that we encounter in the shelter environment, or in any environment really, in three ways. So physical hazards, biological hazards, and chemical hazards. The categories of these hazards can overlap, and some things can fit in more than one category, but generally physical hazards include things like falling or slipping or noise in the environment or being maybe knocked over by a dog or wrapped around by a leash. Biological hazards include things like diseases, but also biological products like vaccines. And chemical hazards include all of the disinfectants and the chemicals that you'll be learning about in the sanitation segment, as well as things like anesthetic gas and the medications that we use on a daily basis. Even the things that we use to keep ourselves safe in the shelter environment are sometimes also classified as hazards when they aren't used properly. For example, hand sanitizer is a great way to sanitize your hands, but if you get it in your eye, it is a chemical hazard. When it comes to chemical and physical hazards, shelters have an obligation to protect their workers, just as every work environment has an obligation to make sure that the work environment is safe. This often happens through OSHA regulations, especially about things like noise and air pollution and taking breaks and how much you are required to lift on a daily basis. But sometimes we also get injured on the job, and in those cases, the employer is required to pay for care through workers' compensation agreements. In addition, both OSHA and our guidelines state that shelters must provide the protective equipment that the workers need to keep themselves safe, such as gloves and smocks and goggles and face masks and face shields, shoe covers, earplugs, all of those types of things. It is not on the employee to have to bring these items to work. The employer has to provide them. Since the series of injuries that happen in the work environment may not be immediately obvious, our guidelines also say that shelter supervisors must advise people who are injured at the shelter by a shelter animal to seek medical care. And this includes people who are injured by shelter animals off property, and it includes people who are not employees of the shelter. Animal bites are a frequent occurrence in the shelter. Hopefully, some of the lessons that we can take from animal handling and the behavior sections can help reduce this hazard. But it is ever present when we are dealing with unknown animals with unknown personalities and tendencies. Almost everyone in the animal shelter is at risk for animal bites. This includes everyone from animal care officers to front desk staff, basically anyone that ever touches an animal. It also includes adopters and transport partners. In addition to pain and injury, which of course can be severe, there's also the risk of infection and rabies with any animal bite. To help protect shelter personnel and adopters, shelter personnel must ask about potential rabies exposures when animals are admitted to the shelter. And this includes whether an animal has bitten anyone, and also includes whether an animal has been bitten or in contact with wildlife in the previous time before coming into the shelter. Now, the answer to these questions, maybe I don't know, and I have no idea, but not asking can pose a serious problem when the information is actually available. To help protect shelter personnel and adopters, we also want to make sure that personnel who routinely work with animals receive rabies vaccinations, if that is at all possible. The animals we encounter often have unknown histories and may be more likely to be at risk for rabies than animals that present to veterinary clinics or to boarding facilities. Rabies isn't the only zoonotic disease we encounter in the shelter. Animals and people share a lot of diseases, and even diseases that we haven't discovered yet. Taking routine precautions helps even when the threats of disease are unknown. This includes routine use of personal protective equipment and hand washing during intake exams and cleaning, for example, or responding to disease as soon as it's recognized during population rounds. It also includes setting up the shelter environment to support animal behavioral wellness so they don't get sick in the first place. Even it extends to feeding cooked, nutritionally sound food to your animals, as well as, obviously, proper sanitation. The two hottest topics in zoonotic disease at the moment are antimicrobial resistance, which is usually referring to bacteria that you can't kill with conventional antibiotics, and the concern that this bacteria could spread from animals to people or vice versa. And so the statement that we have in the guidelines about this is that antimicrobial use must be tailored to appropriate clinical conditions and used judiciously and evaluated for therapeutic effect. And when it doesn't seem that the antibiotic is doing any good, that the antimicrobial is discontinued. The other hot topic in zoonotic diseases is COVID, which we know that cats can get from people and that they can shed, although we think this happens pretty rarely. If an animal has a known zoonotic disease and the shelter is transferring them to another organization for treatment or releasing them to an adopter or foster parent, the shelter has an obligation to disclose that risk, whether it's as mild as Bordetella or as significant as ringworm. Supporting a safe and protected working environment for people is really key to keeping both people and animals healthy. But as we've been talking about with animals, the mental state of people is also important and can be significantly affected by their environment and the management of the animal shelter. Making sure that shelter employees are supported in the work they do, not just through providing the appropriate PPE, but also through training, setting clear expectations, positive organizational culture, fair pay and hours, provisions for self-care, and ready access to mental health support systems without repercussions are all really important. This may seem like a lot of extra work, but it pays off. People who are happy with their work do better for the animals they are taking care of and don't look for other jobs. There are a lot of ways that working in animal shelters can be extremely enriching, not just for the animals, but also for the people who are there. Not to bring you down, but we all know that shelter employees in particular can have high levels of compassion fatigue, secondary traumatic stress, moral injury, suicidal ideation, and burnout as a result of the challenges of our daily work. There are a few things we can do to try to help. When mental health concerns are communicated or observed, shelters really should encourage their personnel to seek professional help. And we believe that committing to the people as well as to the animals, giving the people what they need to do their job well in a great environment in which to do it, can help everyone involved, human, animal, and population. Thank you so very much. And now on to the next section.